So the outline is simple. There will be two things that I'll be discussing in these 20 minutes or so. The sources for the research question and the characteristics of a good research question, because that's basically what's going to give you the lead on the study selection and you know, the possibility of finishing the study or just staying at the very beginning. I just put here all the different places where you can actually get research questions. If you do medicine and see patients, a lot of times your questions come from the patients that you see, or the weird cases that you have to deal with, or things that you don't understand why they're happening that way. So just by seeing patients, many times we do get questions, and then you go to the literature, you look at what is available, and from there you can think about a study. But then if you read medicine or any type of paper, if you don't do medicine, from other studies that have been published, there's always at the very end of the discussion or before the conclusion within the discussion, the future areas that the authors are proposing that need to be further researched. So there's always the possibility from reading and searching answers for yourself to find new questions and new studies that you can put together based on what has been published. If you go to meetings, either local meetings, very local meetings like Research Louisville, or national or international meetings, just by networking and hanging around and discussing with people who are presenting, you can get ideas from something that you see. So that's another good point of trying to figure out what's going on around the area in the topic that you're interested in, and then get some feedback and some further questions to be answered. The literature, it kind of ties that to prior studies. I mean, the prior studies could be prior studies that you've done, and based on that data found, you have new questions, or prior studies that have been published, as I mentioned, and that you have further questions or ideas from what it's been published. Brainstorming, that's probably what we do every day, every single time that you have 2 minutes to think about something. You brainstorm with yourself or you brainstorm with a group, and that's probably one of the best things that can happen. Just sitting down and getting together and going through projects, things that are going around, discussing things that have been happening, and from there getting further feedback and questions that you can possibly put into studies. The main thing for a question, and we all have questions, and every time you start something, you do have a question. So the issue is not really getting a question. You always have questions that could be answered. Then the critical thing about the question is that it has to be a question that is realistic, and it's something that you can do. So before moving forward, after having a question, you really have to sit down and think, is this a question that is relevant, that is important, that needs to be addressed, and that I can address based on the resources that I have? Otherwise, you get stuck with the question at the beginning of the planning of the study, and then you may not be moving forward. Or even worse, realizing that you're going to finish the study when you're halfway through. So this ties with the good research question and how you try to define if your question is good from the perspective of a study. Now, again, keep in mind, all questions are good. The issue is a question that you can translate into a study. And that's what I'm relating to. There is an acronym that you can use that is FINER, and FINER really stands for feasible, interesting, novel, ethical, and relevant. And sometimes it's not that easy to define if your question meets these criteria. And I would say that doesn't necessarily have to meet all of them, but some of them are very critical for you to be able to then get that study out and published. That is the ultimate goal, get your research out for people to know what you've been doing. And feasible has to be with what I was discussing, that you or your team have the resources to do it. And we'll discuss a little bit further what resources mean. That is not necessarily and only money, although that's sometimes critical. That is interesting for you and for the society, ideally, but sometimes with you it's more than enough for the first steps. That is novel. That means there is a gap in knowledge. There is really no point, and probably it's not going to be published anywhere, a study that you have done that answers a question that has been answered already 1 million times. So, embarking into a study where you know that what the answer is, it's sort of pointless. So one thing is to do a good literature search, and that comes into place this brainstorming and the researching and the networking, so you know what the gap is. And again, many times you could frame the problem and create the gap. So it's not that it has to be, oh, nobody knows. It could be that there are some answers that are some questions that had been answered, but in a certain population, and you're interested to try to see if your own population kind of correlates what has been published. There is data from the VA, but data from the VA is all in, elderly, mostly males. There's nothing published on females, and it happens to be that your cohort of patients is of females. So that's the gap in knowledge. It doesn't necessarily have to be that nobody knows. It might be that nobody knows in the area that you happen to be having the possibility of researching. Of course, it has to be ethical. The classical example would be a new antibiotic for, in this case, for example, community-acquired pneumonia, and you are designing this randomized clinical trial, and your comparator, your other arm of the study is going to be with placebo. Well, nobody's going to approve that because you're going to treat bacterial community-acquired pneumonia with an antibiotic. So you cannot leave an arm, patients in the study with no antibiotics. We are doing an HIV study with the NIH. We are one of the sites looking at the use of statins to prevent cardiovascular disease in people with no risk factor for cardiovascular events. So those who will not be studied on statin. And why is that they are picking this group? Well, because the study is randomized and it's blinded. So if you have a patient who has the indication for statin use, you cannot enroll that patient in the study where there is 50% chances that the person is not going to be on a statin. So all those things have to be accounted for when you are designing the study, okay? And of course, thinking your question. You may not get to the study design even. And finally, pass the so what test. And the so what is I would call it a Dr. Ramirez term many times. But I love it because really, many times if you're reading abstracts, I mean, when you have the full article, sometimes it's not that the case. But particularly in abstract or posters, when you get to the final part, conclusion or discussion, and then you say, well, then, yeah, you found this. So what? You have to have the so what for your results and the so what for your study. Otherwise, it's kind of, well, what is the relevance if I cannot bring the so what into the table? Okay? As I said, again, I mean, these are the critical concepts. You are not supposed to do a study that is going to bring answers to something that has been already established and is known. And this is the balance between the realistic questions and the important question. And as I already said, the questions are all good questions. The main thing that you need to be able to assess and determine is that your important question can be transferred into a realistic study. It may be a very relevant question, but something that you're not going to be able to address in the time that you have. The problems with the research question and why some research questions don't move forward beyond a question, mostly because they are not feasible. They are very good questions, but because of different issues such as not having enough subjects to be enrolled, or not having enough resources, or not having enough time, you cannot finish the study. So the question kind of ends there and doesn't have an answer. And this is critical. Many times we have residents or fellows come in and said, well, I have research time and I have to do a project and I was thinking about that. And the question is great. But basically, that person may have 1 month, twice a year, for 3 years, but actually that person is already on the second year of the residency. So it has 1.5 years with 2 or 3 months here and there. Well, it's going to be very difficult that you can do a study and get the study done and get the results out and written in that time for a question from the very beginning. So all those things are what, in theory, you're supposed to take into consideration and analyze before you decide to move further into probably anything, actually, not just the research question. And related to the research question comes the concept of study design. You will see here that, we have rankings for study design, for type of studies, and the randomized clinical trial is what everybody actually shoots for and wants to do, and it's the optimal and best study design that can be out there. It's when you look at the literature and you look at guidelines, when they refer to level of evidence and they talk about, the 1, the 2, and the 3, that is based on randomized clinical trials or just observational studies or nothing, and basically somebody saying, I think this is good. So the randomized clinical trial is the optimal and best study that you can potentially shoot for. However, There are several questions that are important to be answered and will not be answered through a randomized clinical trial. So keep that in mind when we go through the following slides. The type of studies are basically classified or structured or addressed considering these three concepts. The timing of the outcome, when the outcome occurs, if it's in the present or in the past. The role that you take as the investigator, basically you do something or you just look at and observe what's happening. And then if you're going to be doing some degree of analysis, even if minimal, or if you're just describing your population. So when we are looking at study outcomes, and then the timing of the outcome occurring, if the outcome that you're evaluating already happened, what would you say that study is? If I look at patients who were hospitalized because of urinary tract infection, but this is in 2014, I'm looking at things that had already occurred. The event, the urinary tract infection, but also the outcome of that event, patient is alive, dead, discharged. That all already happened. That will be a retrospective type of study, okay? If I'm following the patient forward, even if I'm not doing anything, but if I'm following the patient forward, waiting for the outcome to occur, that will be the prospective study. So if we're thinking about randomized clinical trials where you do interventions and it's always prospective, okay? Whereas most of the things that we do in clinical practice and, when we start doing research that is looking at data from the medical records, all those studies are retrospective because what I'm looking at already happened, okay? So if we're looking at what we do as investigators, we could say that we take a passive or an active role. And the concept here is, if you take a passive role, basically it means that you are observing what's happening. You can do analysis or not. You can do it prospective or retrospectively, but you are doing an observational study. And there are different types of observational studies. The simplest and easiest to do, not necessarily to publish many times, is a case report. Okay, you just have one patient with a very interesting presentation or outcome or disease. You just put that together, get a little bit of data from what it has been published in the past, and you send it somewhere. You present it in a meeting, you try to submit it to a journal. That will be an observational retrospective study, because what I'm describing already happened, and I'm not doing anything but observing. If you have more than one case, a few cases, you will be doing a case series, more or less the same with more patients. You can do also case control studies where you have two populations that are matched based on whatever, age or gender or clinical characteristics or time of the year. Or you can do cohort studies. And usually cohort studies is what we do the most and what you will find in the literature happening quite often. You just have this group of patients that you can have two groups. So it's not that cohort, you are just following a population. Case controls, you have two groups. Cohorts, you can have one group, two groups, three groups, four groups, but you are just observing what happens with that population. If you're taking an active role, what would be the definition of the study? It's an interventional design. So you are doing something on that patient. And that's something that doesn't necessarily mean that you are giving a drug or you are studying a new drug. An interventional study could be a survey, for example, sometimes. So we think about interventional studies as randomized clinical trials, but not necessarily that's the case. And you can see here that you could have a randomized clinical trial, but you can also have a non-randomized clinical trial, where you have two groups, but they are not randomized. And then the last part of these three items to consider for study designs are the type of analysis, and this is pretty simple. If you describe the population, you are doing a descriptive study. For example, I have my 2,000 patients in our 550 clinic, patients with HIV. We have not been looking at our data. I don't know if we have more females, more males, if they are younger, if they are older, if they are all presenting very late in the disease. So I just collect data in a retrospective manner, put together a database, and then I just count. I have 70% males, 30% females. I have 20% being younger than 20 years of age, 30% being older than 50 years of age. I'm just describing. I'm not comparing this versus this. Okay? And that could be a very good study when you're trying to develop a process and really know what's going on, in your city, in your clinic, and that's not necessarily something that is bad or poor or pitiful, okay? If you are comparing, and there are analyses that are more complex or less complex, but if you are comparing different populations in your study, you will be doing an analytical study. And here, many times, you can start on a simple type of comparison with chi-square and Fisher and t-test, or you can go more complex into the multivariate analysis and things that you need for, deeper type of studies, and that's where you get your statisticians friends to come and help you. And hopefully you understand each other. And that's a different talk. So trying to put all these concepts together into a flow chart or an algorithm or whatever. If there will be any, so the question will be, is there any intervention happening in your study? If you say no, that's what we define as observational, correct? You are not doing anything. You are just observing what's happening. If you're going to be comparing patients or not, that's the second question. So if you are not comparing, you are doing a descriptive study. If you are comparing patients, let's say, who dies more, patients with COPD or not COPD admitted with pneumonia, or patients who have HIV alone, or HIV and hepatitis C, or people who have hypertension with and without kidney disease. I'm going to be looking at outcomes, mortality or, hospitalization, length of stay, whatever. Then that will be an analytical study versus a descriptive, that is what I just mentioned a little bit before. Both studies, descriptive and analytical, also have the concern and the question of the direction or when are the outcomes occurring. So as we mentioned before, if you have your exposure or your variable of interest or the disease that you are evaluating happening in the past and the outcome also happening in the past, which type of study this is? Retrospective, correct. So everything already happened. If I have the exposure in the past, because I already know the two groups, but then I'm going to be following those patients to see who dies more, or who survives, or who has an opportunistic infection, or a stroke because of a new blood pressure medication that I'm investigating, that will be which type of study? Prospective. So if you think about these type of studies that are the observationals, the ones that we do the most, at the beginning, in the middle, and many times at the end of your career as an investigator, because not necessarily everybody will be able to do an interventional randomized clinical trial, and we'll discuss a little bit more about that and why. These are going to be the ones that we are going to be doing as residents, as fellows, as junior faculty, and sometimes at more advanced faculty, because you're going to be helping other people doing, observational studies at the very beginning. So these two studies, or this type of studies, are things that if you are getting into clinical research, you have to master and understand how they go. How you define the study, how you develop the study, which documents you're going to need for these studies, what are the things that you're supposed to do from a regulatory perspective, financial, and all that. The retrospective studies are, we do that every day, actually, even if we are not thinking that we're doing research. If you're collecting data because you want to see the patients that you saw in the clinic with diabetes and you're trying to see how many have neuropathy, just for you to know how many of your patients have neuropathy, well, what you're doing is a retrospective type study. You're not doing clinical research at that time from the definition perspective because you are not generating new knowledge. You are not transmitting that knowledge to anybody else but you. But that is a type of research. Patient care is research every single day. So the retrospective is a study that it's perfect for situations where you don't have a lot of resources or time, or the disease that you're investigating doesn't happen often. So for example, let's say that you're going to try to study this type of tumor that, the prevalence is very low in the population, so then you have 3 patients a year. Well, if you really want to investigate that study prospectively, how many years you will need to have a decent number of patients to publish? If you want to have 50 patients, 100 patients, so then you don't have to do a case series or a case report, you will need several years. It's not a study that you're going to do prospectively. That will be a study that you're going to do retrospectively because you already have let's say from your medical records, your billing office, you already have the patients who develop that cancer. Whereas if you're studying, if I want to see, I don't know, disease that is very prevalent, that you have patients every day in your clinic, well, you could say, well, I'm going to do it prospectively based on the number of patients. Based on the time, you might need to do it retrospectively because you might have only 1 year. So if you really have a lot of patients, if you go retrospectively, you can capture more years than just that 1 year that you have for the study. Is this clear? Because that's how you really end up deciding many times which type of study you can do. It's not that you may not be able to do the randomized clinical trial. The research question might be the perfect one for that, but you may not have the money. So no randomized clinical trial. And then again, the last leg of this algorithm, if you do interventions, it would be an interventional study. If you randomize or not randomize, that defines what a randomized clinical trial is. That is basically, I mean, when you explain this to the patients, you say, well, we're flipping the coin, so I throw the coin and, 50-50 chances for you to be on one side of the study or on the other side of the study. So if we put all these studies together, this will be like the ranking from the worst to the best. So the worst, from a scientific perspective, if you want to put it that way, will be a case report, and the best will be a randomized clinical trial. And yes, this is the way of ranking the studies. But again, keep in mind, the study that you are going to pick is not going to be based on this ranking. It's going to be based on your research question and on all of these feasibility things that we were discussing with the research question. The time that you have, the money that you have, the team that you have, the type of patients that you're going to be evaluating, the resources. So not just because the randomized clinical trial is what is expected for you to do, is what you're going to be able to do. And most of the time, we start with case reports and case series, and we move up. We might be part of the randomized clinical trial. Many times you will do them as part of a company-sponsored trial, that you are one of the sites. But it may not necessarily be that you're going to be the principal investigator on that randomized clinical trial. Tied to this is this concept of, well, if I don't do a randomized clinical trial, I'm never going to publish in a very good journal. Who's going to publish a retrospective review of X number of patients? Who's going to publish a case series or a case report? Do you recognize this journal? The New England Journal of Medicine. You would say, well, this is one of the best journals that you can get something published on, correct? So, I mean, the letter, the size of the font is small, but if you see the title, and if I can read it, I'm going to read it from here because it's not in the computer. So this is pneumocystis, when pneumocystis was named carinae. So you can see that it's at least, a few years old. In mucosal candidiasis in previously healthy homosexual men. If I give you a year, which year would you pick that this could have been published? Well, I know that it's there, but maybe you were not seeing it. I was hoping, actually. Well, maybe Dr. Ramirez can guess. So this is from, the 80s, when the first people with HIV were being not diagnosed with HIV, but they were finding, these opportunistic infections. So I highlighted here. So this article had 4 patients in the New England Journal of Medicine. Why? Well, because in the 80s, 4 patients who were previously healthy presenting with these type of infections were not things that physicians were seeing every day. If you try to submit 100 patients today to the New England Journal of Medicine with pneumocystis pneumonia, it doesn't even pass the editor. Probably the secretary getting the email sends it back to you. Okay? So not because the study is a simple study doesn't mean that it's not going to be in a good journal. Other examples of New England Journal of Medicine or big journals are pandemic flu in 2009. There were 100 cases or so presented, published by the New England Journal of Medicine. This other one in 2005, when at that time all the necrotizing fasciitis cases were mostly related to group-based strep, and then they started seeing these patients with MRSA presenting with necrotizing fasciitis coming from the community. These are 14 patients, yes, 14 patients, again, in the New England Journal of Medicine. Why? Because before this, there was no literature reporting community-acquired MRSA causing skin and soft tissue infection. Today is something that at U of L you see quite often. Okay? So, to summarize and close this, the research question is something that you have to really think about before going further, because it's the critical point on related to which study you're going to do and if you're going to be able to finish. So questions are all over the place. And this thing that I was discussing about, well, you're a resident or a fellow, you have 3 years, you have a research question, but you don't have a study, so you have to start the study from the very beginning. You know, the protocol, the data collection form, the IRB, collecting the data, putting the data in a database, analyzing the data, who's going to help. Sometimes it's difficult to find at the university here who can help you. Well, there are several groups. We are one of them. I would say we are the group, but doing clinical research, if you really want to get into clinical research, a lot of people doing basic research. So when you're studying, the best thing that you can try to do is to attach yourself, plug with other groups that are already doing this. You start collecting data, you participate in the trials, or in the retrospective studies that they are doing. And from there, you can get questions that the data has been already collected for several patients, and you can have a study with your own question, but just because you are part of this other group. If you were on your own, that would be much more difficult to accomplish.